we'll talk about something which all of us do endure at one point of time or the other, but are unsure about how to go about it, which is a soft tissue injury around the knee, which could be a ligamentous injury, could be a bony injury. But when do we consult a doctor, and what do we do about it, and how do we go about approaching this particular problem? So at the outset, let me tell you that all of us want to be fit, want to be active, and want to carry on with activities which give us happiness, which give us some sort of a satisfaction in terms of overall day-to-day living. Now, to add to this, some people are keen on sports, some people are keen on bodybuilding exercises, some people are keen on just adventure sports of various sorts. It is but natural that sometimes or the other, we do tend to wind up with injuries, especially around the knee. Now, this is something which bothers us, but we don't know when is it that we need to reach out for help, when is it that we need to consult a doctor. The most common complaint which we come with is usually pain, swelling, and difficulty in walking. To differentiate this from a bare minimal soft tissue injury or something which involves any of the ligaments is something which we need to see. Now, the knee is supported by various ligaments. On the sides, it is the collateral ligaments, which is the medial collateral as well as the lateral collateral. And inside the knee, there is the anterior cruciate ligament and the posterior cruciate ligament, which gives it stability both in anterior posterior planes, which is to prevent the knee from buckling forward and to prevent the knee from buckling backwards. Now, these are slightly more severe of these injuries. So that means that the trauma which the individual has sustained has perhaps been of a more severe nature. So when we are looking at playing a sport or probably some kind of an event which led to an acute onset swelling, subsequent to that, the patient complains of severe amount of instability, pain, and inability to walk, that is, to bear weight on that particular affected limb. It is but mandatory that one should consult an orthopedic surgeon preferably, or at least a doctor. Bare investigations would involve an X-ray to rule out anything bony, which is a small chip fracture of any sort involving the articular surface, or maybe an MRI, which may be indicated if the surgeon so feels. This indication is perhaps usually done only to rule out a more severe kind of a ligamentous injury. It will also help us in quantifying what is the grade of a ligament tear, if any. Along with that, some amount of meniscal injuries are also known. Now, meniscus is something which is something like a shock absorber present within the knee joint. Now, the current concept involves that any of these ligamentous supports of the knee or of the meniscus involving any kind of injury should be repaired. These are vital for stability of the knee and also prevent further progression of osteoarthritis if left untreated. So here at Care Nampally, we have a team of surgeons who will help you in this particular aspect. If in case you do face any such complaints, feel free to walk into any one of our OPDs, scheduling an appointment, and we will be able to guide you to the right